Welcome, everybody. Welcome to another edition of Mondays with Mark. And I'm really excited and honored today to have Catherine Wright and Colin Madigan here from Definitive Healthcare. And just as a note for those of us listening today who don't know this, Catherine Wright is also on our board of trustees. So Catherine has a sort of dual role here with us at Crossroads Continuum. Welcome, Catherine. Welcome, Colin.
Thanks for having us.
Absolutely. I'm really excited to hear more about Definitive Healthcare, your role with Definitive Healthcare, and the relationship between Definitive Healthcare and Crossroads Continuum. Especially for those in the audience today who don't know that. It's my understanding that this relationship began approximately 5 or 6 years ago. Is that an accurate portrayal?
Yes, it's starting to blend. It's either the 5 or 6 years. I can't remember, but at least 5 years ago, probably around 2016, if I remember right.
Oh, okay. Okay. And my understanding further is that it's around this time of year as well, with the 5K coming up next month, beginning of next month, at sometime around that time. That's when the relationship forged.
So that's part of the story. So Catherine, take us from the start. It's interesting how, the inception of Definitive and Crossroads.
I would love personally to hear more of that story from both you, Colin, and Catherine. And I know our audience would love to hear the same.
Sure. Yeah, we found Crossroads as a very happy accident that we're lucky we were able to. So Definitive Healthcare, we were originally located near you all in Framingham. We're still in Framingham, but we are, a healthcare analytics company. Work really heavily in the life sciences and the healthcare space. And something that's really core to our company is giving back to the community. So that was something that our founder, Jason Krantz, felt really, really strongly about. Is we've had so much luck and success as a business. How do we think about being really good partners in the community and giving back to those that we can? So we started something that we call Definitive Cares, which is a great program at Definitive. It does a couple of things. So it encourages an employee to volunteer at least once a year, but up to 4 times a year. So we have an entire team that works setting up opportunities for employees to go out in the community, to volunteer or to donate or contribute whatever way they'd like. And it's a really great program. You get to meet other people at the company. You get to, give back to your own community. And then you also actually earn a day off if you volunteer, which is pretty cool. So we're very proud. We've had actually 100% participation of that program since its inception 5 years ago, and very, very kind of core to our company. So long story short, we had just started the concept of Definitive Cares, and we were looking around for local partners. And we said, we love the idea of partnering with a really local organization that we can immediately impact. I think I maybe Googled Framingham 5Ks at that point. And the Crossroads 5K had come up for us. I reached out to Kelly, our development director, and I believe it was her second week on the job. So it's been a really cool relationship that just as we were really starting to think about what does Definitive Cares mean, what does that program look like, Kelly had also just come on board and started to think about what does it mean to engage with partners in the community? What does it mean to build out a corporate development program? So I think we've been really, really close partners ever since. The first time Crossroads did their golf tournament was the first year Definitive Cares did a golf tournament. So a lot of shared learning, what's working, what's not. So just a really cool partnership I think we've grown together. And we definitely model a lot of our Definitive Cares relationships off of the Crossroads Definitive relationship. As just a really cool intersection of 2 organizations.
Oh, that's great. Yeah, that's a very nice story. Yeah, for sure.
Yeah, right. Timing is everything. So it was just funny how it worked out that, we found you guys like right when you guys found Kelly, and we're, starting to really invest in the development effort. So, the timing could not have been more perfect. And now that we've been working with you guys for the past 6-ish years, this is definitely one of the more popular organizations within Definitive for any type of Definitive Cares engagement, right? So I forget where we even started. Like, Catherine, do you remember the first event that we did with Kelly? Was it Halloween maybe, or?
I do think it was the 5K, but then was very closely followed by Field Day,
Yep.
which I'd say is a fan favorite at Definitive. It is
That's
a
right.
great experience to see your coworkers play tug of war. You don't see it very often, and people love getting out and you know hanging out with the kids, and it's really one of the special events where we're actually able to interact with the students, which is amazing, and I think just kind of brings the mission a little bit closer to everyone that's had the opportunity to be exposed to Crossroads. So there is always a wait list for that event, which is cool.
Yep.
Yeah. Yeah, that sounds definitely cool for sure. Yeah, we're somewhat hopeful maybe there'll be such a thing this summer, but you know we'll have to wait and see, given the environment that we're currently in. So from Definitive Healthcare's point of view, what's the relationship like with us here at Crossroads Continuum? Because I know from our perspective, you know, I think if I say value completely misses the mark in terms of emphasis on our relationship with Definitive Healthcare. We think it's tremendous. We get so much from it. So I'd be curious to hear, excuse me, from your perspectives, what that relationship's like with Crossroads Continuum.
Yeah, so I can take this one. So, I mean, I think to Catherine's point earlier, like we've really tried to model the way that we work with and engage with other community partners off of this relationship. So I think, you know, kind of like a happenstance that brought us together. But after that, I think we kind of realized with the smaller group of like myself, Catherine and Kelly, like, you know, we can probably accomplish a lot with just a few of us if, you know, we do the right things to get people within Definitive to, you know, buy into the cause. So I think one of the big pieces there is, you know, it's hard to get people to rally behind something when they're like, Crossroads School, Crossroads Continuum, what's that? Never heard of it. So I think one of the big things that we tried to do at the start is just, you know, we were a company of maybe 50, 60 people at that time. So, you know, it's possible to have some people from Crossroads come over and do an in-person lunch and learn, right? This is 2017. So yeah, we had lunch and learn to kind of promote, you know, this is the Crossroads School, now the Crossroads Continuum. You know, this is what the mission is. This is like the community that it's serving. It's right here in Framingham. So, I mean, for me personally, that's something that always motivates me. I think donating to the Red Cross and donating to, you know, big organizations where there's a lot of money that's going into it. I don't know what's slipping into different administrative fees or, you know, just falling off of the balance sheet. Whereas when you're working with something within your local community, you actually can see the impact, right? Like you know the kids that you're working with, you can actually see over time, like, you know, improvements. And we're actually fortunate enough to work with you guys to, you know, staff one of the students from Crossroads in like a, what was that, in an internship position at Definitive, which then turned into a hiring as well. So I think that's something that really resonated with me, just the fact that, you know, this is something that's a local cause. You can see the direct impact. And I mean, yeah, right here in Framingham in Natick, it was very relevant to us. And then even with you guys moving, I think at that point, we kind of realized like, you know, we're still growing as an organization. Crossroads is still growing very quickly as well. So we need to continue to do this on some regular cadence. So yeah, I think it's kind of like every year before the, or in the lead up to the 5K event, we like to do some type of, you know, virtual, well, not virtual, but yeah, some type of lunch and learn, you know, rally the troops, get them together so that, you know, we can all come together for this cause.
That's great. Thank you, Colin. I appreciate that for sure. Yeah. Catherine, I was wondering if you had anything you'd like to add to that in terms of from your point of view?
I'll just add, I love to see the retention of people that have had one interaction with Crossroads, and then they just continue that path. So the people that, you know, came to the 5K year one are still participating. The people that always sign up, as I said, for something like Halloween or sign up for Field Day are always the ones that sign up the next year. So we have this growing just base of people that are really invested in Crossroads, really invested in the mission. So I just think, you know, it's just making that initial connection. Once people are able to get to know the school and the broader Crossroads Continuum organization, they just totally understand right off the bat why we want to help, why we want to get involved, why it's such a valuable partnership. So that's just really nice to see kind of that retention, the continuity of engagement within just employees and other folks at Definitive.
Yep. And I'd say too, it's definitely gotten to the point where, as we're getting closer to, like July, and we know that Crossroads Field Day is coming up, I'll get some people who start, IMing me or being like, hey, when do you think like the post for this event's going to go up just so I can sign up beforehand? So yeah, there's definitely a high level of enthusiasm there, especially around the field day for whatever reason. I mean, I think all the events are fun, but yeah, field day, people seem to be, lining up early for that one.
That's great. That's really interesting. I wouldn't have predicted that, I think, but yeah, that's great. You mentioned, I think, Catherine, you mentioned at sort of closer to the outset about Definitive Healthcare being a healthcare analytic organization. Can you tell us a little bit more about Definitive Healthcare? Because I know our listeners would like to hear more.
Sure, yeah. So we work in the commercial analytics space. So we really work with a really broad variety of stakeholders that have an interest in the healthcare market. So, whether that is a life sciences, a pharmaceutical company, whether you're maybe a professional services or a consulting company, the people that we partner with are the folks that are working with hospitals, they're working with physicians, they're doing drug development. They're looking to understand, how do you bring a new market to drug? How do you evaluate a rare disease market, right? And how do I get a drug to patients where maybe there's a lack of access or a very complicated distribution network. So it's a very interesting space to be in. The variety of people that we work with and the clients that we serve is really incredible. And Colin works really closely with our clients. So I work on our product management side of the house and build out the platform that our customers use, and they come to us to understand their market or their patients or whatever that is. But definitely would love to hear from Colin too. I think Colin's job is really great in that he's actually day to day talking to our clients. So I don't know if you have anything to add to that, Colin.
Yeah, totally. And then I'd say too that so Catherine and I have both been with for over 6 years is it for you now, and 8 years for me. Whereas when we started at the organization, it was way smaller than it is at this, way smaller than we are now, right? So more of a startup environment, maybe 25-ish people, I want to say, when you started, Catherine. Now we're a 550 person machine, international. We've gone through a couple acquisitions. So while that's all happened, we've also gone through different roles as well. So when I started off in 2013, I was essentially our face of support at Definitive. So any type of, if the phone rings, if we get an email, you were going to be dealing with me. If we're trying to talk about a renewal, you're still going to get to deal with me. Marketing, I'm going to do it for you. So now all those different components are different departments and roles, right? So the one job that I had is now a department of, I want to say there's 85 of us in customer experience at this point. So I've gone from, working directly with customers to now I'm just managing directly our medical device team of customer success managers. So we specifically work with any of these providers across the country that, they're selling heart stents to doctors or some type of prosthetic, things like that. So my day-to-day is really working with my team to make sure that, their clients are getting as much value out of Definitive as possible, just by, understanding the depths and breadths of the data that we have, and really just making sure that our team understands, here's the end of the day, here's the point that we want to get to, right? Here's our end goal. Maybe Definitive can get us 50% there, 75%, or all of the way. But it's just actually, working in that consultative manner with customer bases just to make sure that, all right, you guys get the space better, you have clear, accurate data, you understand the limitations of this, and you're able to grow your business off of that. So it's been interesting over the years, kind of switching roles as well. And as Catherine mentioned, she's more on the product management side, and I've gone from being more customer facing to now working with people who get to talk to our customers.
Oh, that's really great. I learned a bunch just in that brief interchange with both of you about Definitive Healthcare. So I thank you personally for that.
Great.
How has the pandemic affected your organization? Because I know here at Crossroads Continuum, it's had an effect, like on many organizations. Just curious, and maybe I think our audience might like to hear that as well.
Yeah, I can jump in from a company organization. I think we've been really fortunate that we've been able to continue to grow and be successful in the past year and a half. We've been able to actually really partner with the folks that are working in this space and be really strategic partners to them. What has been really cool this year to see is that the data and the analytics that we work on has actually been really core to helping some of the key agencies throughout this pandemic. So partnering with, the Department of Health and Human Services and providing them with really crucial data that some folks don't think about. Something as simple as number of beds, right? That's not something that is just readily available. And Definitive does a lot of our own research and curation of data to understand, how many beds are at this hospital, and what does that capacity look like? So we actually did quite a number of on-plan COVID-related data analytic projects that we made accessible and free to anybody that wanted to use them, and had a lot of great feedback from local and federal agencies that were able to leverage that data. So it was really great to, as a company, continue to be successful, but also meaningfully contribute to the effort to aid in the battle against COVID. So that was just a really special opportunity for us.
That's great. That's great. Now, I know, Catherine, too, you have another role with us here at Crossroads Continuum, being on the Board of Trustees. Curious if you want to say a couple of things about that role. And yeah.
Yeah, I do. It's been a really amazing opportunity. We've got a really, really great and committed board, and it's been amazing to partner with yourself and Kelly and the leadership at Crossroads. It's really inspiring, and more than happy to contribute in the ways that we can. So I've been working relatively closely with Kelly and our development team, looking at, how do we continue to build out community presence. Something that we've talked about a lot is, continuing to grow that corporate partnership and community partnership plan. So having said on the other side of things and knowing how beneficial a relationship with Crossroads can be for a company or an organization, it's been really exciting to then try to help, facilitate that relationship for some other folks in our community. So it's been great, the strategic plan. So excited about that. And under your leadership, Mark, we're just incredibly excited for Crossroads Continuum and what that means and how many other individuals will be able to serve. So I think, looking at the next phase of the board and what that means, it's incredibly exciting. So I guess a question for you, Mark, what are you most excited about with the strategic plan? I know there's 10,000 things we all want to go do tomorrow, but what are you most looking forward to?
I think that's a great question. I think it depends on the day of the week for me, but I think largely I'm really looking forward to really fulfilling our mission in and around trying to serve many more individuals with autism, whether we're talking about younger individuals and younger children with autism or adults with autism via various kinds of service delivery options. So I think that's probably something I'm most excited about, is really trying to ensure that other clients are able to access the great services that we currently provide, mostly for our day students.
Awesome. Yeah, being on the call where we rolled out the strategic plan to the wider community, I feel like the resounding feedback was just excitement that people that have had access to Crossroads School, now there'll be more opportunities as students and the children age. You could just tell how excited folks were that there is, more opportunity to continue to engage with the staff and the leadership at Crossroads. So that's amazing. Definitely looking forward to that.
Yeah, it's a really exciting time. I'm glad to be able to partner with you in your role as as a Board of Trustee member, as well as you and Colin in terms of your role with Definitive Healthcare. As I frequently say, we are only as good as the support that we get from the community, and the support we get from Definitive Healthcare enables us to do the things that we would like to do. So thank you both for that.
Of course, we're proud to be one of your partners. Absolutely.
Do either one of you, thank you. Do either one of you see this relationship being a even longer term relationship, and what might that look like moving forward? Not to put you on the spots or anything.
Yeah, so, I think for me, I'd love to hear a little bit more about, the strategic vision and the Crossroads Continuum mission as opposed to Crossroads School, right? So I'm sure that there's a lot that you guys have put together in your strategic mission that those types of details would be super helpful just in terms of how we engage. But I mean, I think the mission for us always is like to continue to expand upon the partnerships that we have and just get ingrained even further. I mean, I think the relationship that we've built with the folks from your team is kind of, top notch. Like, I don't know if we could really be that much closer to Kelly than we are at this point. So unless we were physically in the same room right now. Yeah, no. So, I mean, like, yeah, I think like the way that we work together as like two teams when we come together has been like just phenomenal. And like, I mean, even internally, people are like, that's like a great partnership. Like, clearly you guys come from the same cloth, essentially, like same type of mission, values, etc. So you guys make it easy to partner with.
Great to hear, Colin.
I'll add, Mark, we're very excited. We know we have the 5K coming up. There were some capacity limits at some point which have been lifted, I understand, which is amazing, but we had done some contingency planning on our side. So we're very excited. We're hosting a 5K on our own in support of Crossroads. So we're going to run as a definitive team, meet the day before, get everyone together. We're going to do a community run and be supporting Crossroads that way. So we've just started recruiting for that effort and looking forward to putting together a team, doing some fundraising. I should probably start running at some point too. But we got 2 weeks to go.
You guys have 2 weeks to train. You're good.
Me too.
But we're excited to continue to support Crossroads. So I think just the flexibility and the creativity that you all bring us to support a virtual option like that. It's actually a great opportunity. It'll be the first time that we've actually seen a lot of our own coworkers. So there's a lot of excitement too around that. It's just really nice to come together, see people face to face and do something that's really positive and impactful. So we're looking forward to hosting that.
Yeah, no, I'm really excited about this 5K. Last year I felt like I personally got cheated out of the 5K, but so I'm really looking forward to having a 5K, mostly in person, with some virtual options. So I'm really excited as well. I'd really be excited also to be in the same room with both of you at some point in time in the near future. So
I agree.
Yeah.
Will you be sitting on the dunk tank, Mark?
Well, not exactly that way, but
No, okay. Maybe next year.
Anyway, I want to thank the both of you for your time today. It was really great. It was informative hearing more about Definitive Healthcare, the relationship between Definitive Healthcare and Crossroads over the years. And more importantly, I want to thank you both again for everything that you do personally and collectively to benefit us here at Crossroads. We are in debt to the both of you for that.
We're happy to do it. We're blessed to be partners to such an amazing organization. And I'm sure Colin would agree here, but if anybody listening on this call wants to learn more about what it means to partner with Crossroads, the types of opportunities, what it's done for us as a company and just for our employees, absolutely reach out. We'd be more than happy to have a conversation and hopefully get you into this type of relationship that's just been so rewarding and amazing over the last couple of years.
It's great.
Yeah, and one last thing I'll close out with. So I just want to commend you guys. I think the way that you managed, remote learning with everything last year was just completely commendable. It was something that we struggled with, right? Going from a company where we're always in person working together to, all right, now everybody's scattered and like you're only talking to each other on the screen. So being able to pivot and, do things like, okay, obviously we can't do a 5K, so let's make this virtual. We can't do a dunk tank, so let's do water balloons, right? Like you guys were able to do things to keep the cohesion there. And even, having, we did a separate thing with Definitive where we had some people come and just do random courses, right? So I did like a 30-minute Macarena lesson. So that was a nice break from the day for me, dancing around in my childhood bedroom on Zoom. So I love how you guys got creative, and I'm sure that your students and the families felt that too, just in terms of you're really putting in all of the efforts there. So just know that was seen.
Oh, nice to hear, Colin. Thank you. And again, thank you to both of you again for your time today. And for your incredible contributions to us here at Crossroads.